To those who have been with us in our previous podcasts, welcome to Sokomaro. We're coming to live from Johannesburg in Midrand, where we are at the preparing for the Pan-African elections that are going to take place on Wednesday next week here, where contestations are happening. And we are coming to live just talking about Africa today. We selected that we talk about Africa and what is happening in Africa, trying to look at different things that are happening. And one of the things that is going to be happening at these elections where Zimbabwean parliamentarian the Chief Fortune Chalumbila is going to be contesting, representing the Southern African region. And of course, we heard that he's also getting support from the Northern African region. Of course, we know that previously these elections or the post of the president has always been held by those from the West. And because they've got the numbers here, West Africa together with the Central Africa and the East Africa, but now it's changing. But this time around, I want us to talk about the first case of monkeypox that has been detected here in South Africa, according to the National Institute of Communicable Diseases. The person that has been found to be affected or infected by monkeypox is a 30-year-old male, and this person has not been outside South Africa, and he has been in here. Of course, and experts are saying that is an indication that wherever he got this monkeypox, it was within the country, or for somebody that is already within the country. So it means they are now hard at work trying to trace all the people that have been in contact with this male that is from Johannesburg, here in Gauteng, Johannesburg, trying to find out who has been in contact with him and trying to trace those people just to test them and make sure that they are not infected as well. And of course, also trying to find out how he came to get this monkeypox. We know that in other countries already, like in Swaziland, the cases have been already identified there, and the number of cases in Southern Africa. We know also overseas, UK has been one of those countries where that has been detected, but it is now closer home, and a lot of people getting frustrated as to what is going to happen next, whether they are going to be shut down, there's lockdowns. But experts are saying no. The better thing about the monkeypox is that it does not have as many fatalities as we saw during the COVID times, where people were dying in their thousands and tens of thousands in other countries. But they are saying the fatality rate for monkeypox is far less. And of course, in about 4 weeks, the symptoms are able to go away and people recover. For now, experts are saying there is no cure for monkeypox, but what happens is that people should limit the transmission. You can only transmit if you come in contact with those that have got the monkeypox. And one thing that we have learned in terms of transmission, one expert from the director of the National Institute of Communicable Diseases there, he was saying what is that is Prof. Puren. He was saying what is very evident is that the majority of people that are being affected now, or that are being found to have this monkeypox, these are people that are say have sex or have sexual intercourse with men to men. Largely it is that group, but he was also quick to point out that it is not only limited to that. We've got females, we've got people that are bisexual that also have the monkeypox. So you're saying it is wrong to say it's only those people who have sex with men who are having this monkeypox, but likely for now, he's saying it is in that section or that group of people where you have got the majority of people that are coming from there. But of course, women have got it as well. But the most important thing, he says, it is that the symptoms, that's what people should be watching and making sure that they get help or assistance in health centers as soon as they see it. Of course, some of the symptoms are like those that we saw with COVID. Of course, some people cough, there's the fever also that comes with it, and of course there are also these pimples or blisters that will affect people, sometimes all over the body, sometimes in the joints, sometimes in the armpits. And these are some of the symptoms that they say if you see yourself having these symptoms, these terrible headaches, that we almost the signs that people were having during COVID, says you should quickly seek for medical assistance so that you are identified and if possible isolated, and if possible get help. But currently, as we know, there is nothing in terms of the vaccine as well for COVID-19 that you can be given. But of course, there's a way of stabilizing it, also using the medication that is already there. But emphasizing that this one is not as fatal as we have seen with COVID. But the first case now here in South Africa, if you are living in Johannesburg, if you are living in South Africa, just give us your views. Have you seen anyone suffering from monkeypox? What is have you seen? If you've got any pictures, send us to us, and just for us to make people aware that it is now within our shores, it is now within the country, and also our visitors to know that monkeypox is now here, and it is all up to us to try and prevent it, and to try and report it when we see it, so that we are also safe as a country. We are also safe for our visitors. And remember, with COVID, it also started in a few countries, and by the end of the day, the years, the weeks, it was all over the continent. So it is all of us that should be alert and looking for these symptoms that have to do with the monkeypox. Monkeypox is here. Swaziland, we had, is there as well. So African countries getting affected. We know that it was in Africa also where it came from, and spreading to other parts of Africa. We are told that the source of it are animals, of course, and now it can spread from one human being to another. And it is only through watching out for symptoms and making sure that we isolate ourselves that we can stop it, because there is no cure currently, as we have heard from the experts. This is Africa. These are some of the things that are happening in Africa, and we are talking about monkeypox. What have you seen there? Remember to subscribe to our channel. Go into the channel and share it and subscribe, and also remember to click the bell so that when we are live, it will tell you that Africa Report News is live, and to give you news from Africa. This is it for this broadcast, but in our next broadcast shortly, don't go away, I'm going to come back to you and tell you about the masks are no longer there in South Africa. If you are still wearing masks in your country, if you are still required to wear a mask, South Africans starting today or yesterday no longer need to put on masks. I'll tell you more when we come back. Tuso Kumalo for Africa Report News. Don't go.